Congresswoman Terri Sewell, and I want to welcome you to another edition of Terri Talk. Now, as you know, we are on day 4 of a government shutdown. We're also in the middle of a health crisis that was created by President Trump and the Republicans in Congress. First, they passed the largest cut to health care in United States history in order to give a tax break to the wealthy. President Trump's so-called big ugly bill, well, that's what I call it, which passed on a pure party line vote, makes nearly $1 trillion in cuts to Medicaid and more than a half a billion in cuts to Medicare. As a result, rural hospitals are shutting their doors. Health centers are closing, and millions of Americans are standing on a health care cliff. And now Trump and Republicans are blocking us from extending critical tax credits that make health care affordable to 22 million Americans, including 53,000 people in Alabama's 7th congressional district alone. If Republicans let the ACA premium tax credits expire, health care costs will skyrocket, not by a few dollars, not by a few $100s, but by thousands of dollars. The average American enrolled in the marketplace will see their premiums double. So for the average family of 4 in our district earning $64,000 a year, it's predicted that annual premiums will increase by $2,571 a year. And that is a 344% increase. At a time when Americans are already being crushed by high cost of living, letting these tax credits expire would only push healthcare further out of reach for the average Alabama family. For months, my Democratic colleagues and I have made it clear that we're willing to negotiate with Republicans on a bill to keep the government open and protect the health care of American people. But instead of working with us, my Republican colleagues unfortunately canceled votes. So we didn't have votes this week in the House of Representatives, Monday, Tuesday, Wednesday, Thursday, or today. And they left American people to deal with their consequences of their own healthcare crisis. And I think that this has been a reckless shutdown, but it's a shutdown of the Republicans and President Trump's making. And make no mistake about it, it is a Republican-controlled House, the Senate, and the White House. They control all 3 levers of government. They could end this madness today. What is clear is that the Republicans are so hell-bent on taking health care away from American people that they are willing to shut down the government in order to achieve it. To me, this is shameful and outrageous, but we as Democrats are fighting back. We believe that health care should be a right for all Americans, not for the privileged few. This is about more than numbers on a page. It's about the lives and livelihoods of the people that I represent. It's about the grandmother who will have to choose between buying food or getting medication. It is about the cancer patient who relies on the tax credits to afford their treatment. It is about the single mom who will be forced to travel hours to get the care that she needs. And it's about children who deserve to live with dignity. This fight is about real people with real stories, and I am grateful today to be joined by one of my constituents, Miss Virginia Hutchinson, who was born and raised in Birmingham, Alabama, and she is one of those 53,000 people in our district who rely on the ACA tax credits to make ends meet and to get the health care that she deserves. Her story was recently featured in an article in the Alabama Daily News, and we're so pleased to have Virginia as our special guest on this special edition of Terri Talk. Virginia, thank you so much for being here. Can you tell us a little bit about yourself?
Absolutely. And I just want to say thank you so much for taking time out of your day. I know you must be so busy right now with the shutdown to take time to talk to me, one of your constituents.
I'm just
Yeah.
pleased. There's nothing more important to me than hearing the stories of my constituents. It's one thing to talk about healthcare in a vacuum or to talk about this big, beautiful bill that was passed and how it affects your constituents and to see the numbers. 15 million people, Americans over the next 10 years will be kicked off healthcare, or 53,000 who depend upon the ACA for their subsidy to subsidize their healthcare insurance. I know that you're one of those and would love to hear your story directly.
Thank you so much. So yes, like you said, I grew up in the suburbs of Birmingham, and then I went to college at the University of Montevallo, and I've lived in several different areas, like in and around Birmingham. In about 2 years ago, I moved out. I got married, and I moved out of state.
Mhm.
And then in 2024, I ended up getting divorced. I was in the process of getting divorced, and I was living somewhere where I didn't have any, family or friends near me. And so I needed to find a new place to live. And I knew the right choice for me was to come back to my home, which is Birmingham, Alabama. And so I found a roommate, found an affordable apartment. I live downtown in Birmingham and I love being here. And as soon as I moved in, the first thing I needed to find was a job that had healthcare. And I spent hours, like all day, every day, applying to jobs. I didn't get very many interviews. It was very competitive. And I was still on my former insurance and I didn't know when it was going to expire. And it was a very, just a difficult time when there was a lot of uncertainty going on in my life. And I realized that I needed to look into the Affordable Care Act because, if I ran out of healthcare and I hadn't found a job in time, I have some chronic health issues where I take daily medications. And when you take medications, you also have to have doctor's appointments to get those prescriptions renewed. I have other routine appointments. I need to have healthcare. And so I found an organization in Birmingham called Enroll Alabama. And what they do is they help you sign up for the ACA because it's very complicated. You can't just press a button
Yeah.
and you get free healthcare. So you have to fill out these applications and the questions are really complicated.
Yeah.
And it's like, what is your household size? And I'm like, oh, I have a roommate. Does he count?
Yeah.
I'm middle of getting divorced. What is my household size? What is my income if it's the middle of the year? And so it was really nice to have some help getting the application filled out. And then once I got approved, there's a lot of different options for plans. And so I spent a lot of time, looking at the different plan booklets and trying to figure out what plan worked best for me. And I figured out that I should buy a more comprehensive plan because I would make up for the money I paid per month. So I pay a higher monthly premium than some other people that are on the ACA. But I have a lot of like routine costs and copays. And so it evens out for me. So that's kind of been my story with getting on the ACA. And then I actually ended up getting a job offer from a local small business.
Yep.
Yes, this is at the end. It was kind of everything kind of happened at the same time. I got signed up for the ACA. It worked. I had a card. I was insured. I had my own plan. And then I got a job in a lot of small businesses because health insurance is so complicated. A lot of small businesses, it's not affordable for them to buy a plan for their employees if they have less than 50 employees. And I have a family member that owns a small business. So that's, something I was familiar with. And so because I was on the ACA, I was able to, accept that job offer. And I'm still working full time and using a Affordable Care Act plan today. So.
That's great. I have lots of farmers in the Black Belt of Alabama that I represent who couldn't afford health insurance until we had the Affordable Care Act and the marketplace to be able to purchase it. I assume that you are being subsidized by some of these tax credits that we're talking about. Can you tell me what your concerns are about those tax credits expiring and Congress not reauthorizing them, what that would mean to you?
Sure. So even with the tax credit, I still pay a good bit for my insurance. And I think everybody in America right now is concerned about the price of their health care. I'm not alone. I think that's a very common concern. So I pulled a statement. So I'm paying about $380 a month.
Yeah.
And so that if I did not have any tax credits, it would be around $660.
Oh, that's
Yeah.
double. That's almost
It's
double.
almost double. Yeah. And so then with, the talks about what's coming, it's if there's changes to the tax credit, but then also if the premium goes up, that's kind of like two increases at the same time. So
Absolutely.
if I had no tax credit at all and I was paying $660,
Mm.
and that doubled, that would be $1,320. And this is for a single person. Like I'm not married, no children, over $1,300. And that's still, I have co-pays, lots of other costs included. That's just the monthly cost of the insurance company.
And the transportation to get to your various appointments,
Yes.
to get to the pharmacy. Listen, you're a living example, a real life example of exactly what I'm hearing from so many of my constituents. Their concerns are, healthcare is expensive, and I think that in this great country where we have so much plenty, that healthcare should be, in my opinion, a basic human right and not a privilege for the few. But we are where we are, and at least you have the subsidies, these tax credits that actually would cut almost in half your premiums that you currently have. But
Right.
people ask me all the time, why is the urgency right now? Why are Democrats, or why are you, Congresswoman, fighting so hard right now to get these tax credits extended? It doesn't expire until December 31st. But you and I both know that right as we speak, all of these insurance companies, Blue Cross Blue Shield, they're sending out notices of their
Mhm.
premium increases right
Right.
now. And
Right.
then you have to re-enroll in
Mhm.
November 1st. So
Right.
the pain of it is being felt right now because I'm sure, I know that I've been looking for my rate sheet, the letter that goes out by your insurance
Mhm.
company that tells you what your premium will be for the coming year. And I haven't gotten mine either, but I'm sure it's coming before the middle of October. And of course, we'll know what that cost is starting November 1 when we have to re-enroll in our healthcare plan.
Absolutely. And that's the question a lot of people have asked me, like, is what are you going to do next year, with all the changes? And it's hard to say when I don't know exactly what that number is going to be. I don't know when I'm going to get it. I logged in yesterday to healthcare.gov just to see. I can't see anything yet, but yeah, my understanding is that, any day now I could be getting something in the mail, getting an
Right.
email with an update. And so that's what makes this so urgent, is that if we wait, another month or two, then it's too late. Insurance companies have already calculated the cost based on, the current budget. So yeah.
Absolutely, absolutely. And I think that that's what I think people are that most Americans don't really get. They're like, oh, well, you can open up government and you can talk about it then. And the reality is, we've been trying to talk about it now. Now, listen, I've been trying to talk about it since this administration came into, was sworn in because
Right.
we knew that this was going to expire end of December. And so we really wanted to give a long runway for the American people and for insurance companies to know that this was going to be renewed so that they would bake that into their pricing for the deductibles and their premiums and the out of pocket that you have to do. And so what scares me is that so many are going to be in the same, so many people I represent are going to be in the same situation you are. I have
Right.
not only small business owners that depend upon the ACA for themselves, their families, and their employees, like you.
Right.
I also have a lot of, small barbershop owners and beauty shop owners that are literally, one mom and pop stores and storefronts. And those folks depend upon the ACA as their sole means of being able to get health insurance. And you're just trying to be a responsible individual. You want
Right.
to be able to pay for your own health insurance. You want to
Yes.
get your own health insurance. It's not
Mhm.
as if you're, trying to uh somehow, scam the system. I mean, a lot of folks can't afford health insurance at all, and it's a
Right.
catastrophic healthcare crisis, into the end of life crisis that causes folks to go to the emergency room. And guess what? We all pay for that.
Yes.
That is spread among because no hospital is going to turn someone away who's critically ill. They swear a certain oath about that, and we don't want folks to be turned away. But that what that happens is that all of those emergency room visits are spread out over all of us, and
Mhm.
because Blue Cross Blue Shield is going to get their money one way or the other, and
Yes.
that's exactly what happens. But so what made you want to speak out about this now? And I want to thank you for just telling your story. I have lots of folks who, come up to me in town hall meetings afterwards and don't want to give their name, and I understand that. But I get so many stories on our website. We have a website, sewell.house.gov /share your story. And I want folks to share their stories. I also want to put a face to the
Yes.
stories that I'm hearing. And I thank you, for Virginia, for allowing us to just to hear your story and what you plan on doing. But what do you think will happen if your premiums double?
That's the question. And I wish I had an answer. I just don't I don't know. And I think a lot of people today, like, it's like all you can do is laugh or cry. It's like
Yeah, yeah,
I don't know.
yeah.
I don't know. I don't
And
have another plan.
right. And I mean, I think that that's the point. And I think that more of my colleagues, I know that our senator is running for governor of the state of Alabama. He needs to hear from Alabamians that this is not some made up crisis. This is a crisis now because you will have to enroll in a plan come November 1st. And, you have to be in a plan by December 1st for it, or otherwise you lose your health insurance. And
Right.
that's simply not an option. Another misunderstanding that a lot of my constituents have is they believe that somehow I'm fighting for insurance for undocumented immigrants. And the reality is that undocumented immigrants, I want everyone to hear me. The fact is, it is illegal. It is not legal for us to use taxpayer money to pay for illegal immigrants for their health care, whether that's Medicaid, Medicare, for their food stamps. I mean, this is against the law. It's in the law. And
Right.
so the fact that people keep saying, especially my Republican colleagues keep saying that's what the Democrats want to do. We're talking about saving the health care of Americans, Americans who work hard every day, who pay into the system, who literally pay their taxes. And, this is to me, such an important entitlement for all Americans to have. And so I just want to set the record straight. I'm not in this fight to help, illegal, undocumented immigrants come, get their health care. I'm talking about folks like you, Virginia. I'm talking about folks like several of folks that go to church with me who've come up to me and talked to me about this. That's who we're fighting for. But why did you choose to speak out?
I chose to speak out because I think that it's not an everyday experience that a policy that directly impacts me is like the center of attention on a national stage. And so I felt like, you know, I've done a little bit of advocacy locally about it that I just kind of stumbled into because I found out about an event. I think it was before the Big Ugly Bill passed, but it was
Yeah.
just for people who were on SNAP, Medicaid, Affordable Care Act policies to hear from people who, were healthcare experts and there were, experts in the field to explain exactly what we can expect. Even though it hadn't passed, they were like, it might change, but this is, ignore the fear mongering. And, when you
Yeah.
can't, everything is so hyper political and hyper partisan right now, like this is what's in the bill and this is what we can expect. And so I went and then it was awful to
Being
hear.
being an informed constituent.
Right, yeah, right. So I
It's
was like, I need to hear about this. And there was a lot of people that spoke about, how many people are struggling right now before the budget bill passed. I was really moved hearing about food insecurity in Birmingham and in Alabama in general. And people spoke, they're like, we are already like, overburdened with how many people need help. And these cuts haven't even taken place.
yeah,
It's like there's so many people right now, and I think a lot of people are going to be affected by some of these budget changes that don't even know it. Um,
exactly. And
it
what's interesting is that, Virginia, I'm sure those experts told you that many of the changes, first of all, these cuts, the $1 trillion cut to Medicaid,
right.
that's over a 10-year period. And,
Mhm.
my Republican colleagues are kind of sneaky. They don't start those cuts until after the midterm elections. So they
Right.
don't go into effect until 2027. And so
Right.
that to me is so deceptive because the reality is people are struggling now. This president came in saying he was going to cut costs for folks, and we've already seen the prices of, groceries going up and gas going up. And now to have folks have their premiums almost double because they're not willing to extend these subsidies is just cruel, in my opinion. And I'm going to continue to hold my ground on this. It's not because I don't want government to be open, but I do want our policies to be fair to all Americans and
Absolutely.
to make sure that we have access to quality, affordable health care. And, we're blessed in Birmingham to have some of the leading regional hospital at UAB.
Yes.
But I have a lot of folks in the rural part of my district in the Black Belt who have to drive an hour and a half just to get to a hospital and sometimes to get to a specialist. And so to complicate all of that, to have to worry about your ability to pay for your own health insurance is just an added burden, I think.
Yeah. And I'm in a tough situation with relying on these tax credits, but as grim as it is, I feel very fortunate because there's so many people that are in even worse situations than I am. Like I have a job. I know a lot of people right now that are unemployed looking for a job, like wanting to be working, and they're not able to find those jobs. So I have a job, I have insurance, and I'm close enough. I live close enough to multiple hospitals, and seeing what's happening in rural Alabama with these hospitals that are on the brink of shutdown. Thinking about like women, like pregnant women out there, that there's no care anywhere nearby. Like that's
And
so
that's the
scary.
first thing
Like
to
I
go.
can't imagine.
Yeah, Virginia, that's the first thing to go. In most of these rural hospitals,
Yes.
when they're trying to keep their doors open, the first thing that they get rid of is their OB,
Yeah, the labor and delivery departments are one
yes,
of the
their,
first to be
their
cut.
labor and delivery are the first to
Right.
get. And so, I mean, from Demopolis to, I can just name them on my hands, all the many rural hospitals that have closed. I mean, if you are pregnant and you live in Demopolis, you're going to have to drive to Tuscaloosa to have your baby. It's just
Wow.
unacceptable. And so we know that Medicaid and Medicare, well, first of all, I don't know if you know this, but Medicaid literally is used by mommies and babies for 90% of the births in the state of Alabama, Medicaid. So, whether you have insurance or not, that's how we pay for 90% of the babies that are born come in through Medicaid. And that is a staggering number. And then when you think about the fact that almost 80% of our nursing homes, people are in those nursing homes are paid by Medicaid. So when you see $1 trillion cut,
Right.
$1 trillion, the largest cut we've ever seen to Medicaid, it's going to impact so many families, not
Yes.
just yours, but so many families. I mean, I can't tell you how many folks have come up to me and asked me about their parents who are in nursing homes. How will they be impacted? How will they be impacted by this? And you said something that was so profound. I have several elderly constituents who literally have to choose between whether they're going to pay for their health care, the prescription, or buy
Mhm.
food. And
Right.
that is a scary proposition, especially when you hear about how many of the food banks are just desperate for food, and
Yeah.
so many people are already in line trying to get help.
Yeah.
Yeah.
And it's hard to get well when you're constantly living on edge and not having your needs met. Like if you can barely afford food and you're barely paying your bills and you're stressed out trying to figure out how to feed your family, you're not going to feel good. Even if you don't have major health conditions. And so it harms everybody. And to me this isn't it shouldn't be a partisan issue because everyone regardless of their political affiliation deserves good healthcare. All humans deserve good healthcare, and I think especially in Alabama, this is a very conservative, very Republican led state, and there's a lot of people here that they need healthcare, and I want that for everybody. And a lot of people here voted for Trump, voted for the Republicans, and I hope that the Republicans support them by supporting our healthcare system. I
Yeah.
feel like our system's already broken, and they're just making it worse.
Yeah. That's unfortunate. And I you know, my dad used to say it's okay to stand alone if you're standing up for what you believe in.
Yeah,
And so I may be going against the grain of most Alabama congressional delegation members, but I know that this is in the best interest of the people that I represent. And not just my people, but the people of Alabama writ large. Like all of us, as you said, deserve to have quality, affordable health care. If you had President Trump in front of you, what would you say to him about this need for us right now to expand the tax credits for ACA?
That's a big question. I wonder if Trump would be interested in hearing what an ordinary American would have to say about this issue. Um, but I think Trump ran on talking about making life affordable for everyday Americans, talking about the economy. He also did a lot of talking about the art of the deal. It's like it's time to make a deal. Like the
Yes.
Democrats are here. They're
Yeah,
ready to
yeah,
negotiate, keep the government open. People are not getting their paychecks right now because the government is shut down.
exactly.
It's time to work together. That's part of the job of being a legislator, of being a politician, and being a leader in general. And so I really hope to see the Republicans um, come to work together in the shutdown.
Absolutely. Absolutely. And none of us want to shut down. Let me just start by saying
No,
that nobody wants to shut down. We want people to be able to go to museums, and we want people to be able to, have a great quality of life and get paid.
right.
We have TSA agents that are not going to get paid, but they're considered essential workers, so they still have to go to work. Same is true with air traffic controllers. It's just to me, it's cruel to like, and yes, they get back pay once we open government up, but you and I both know your rent you can't back pay your rent. I mean,
No,
you are you are
it's
you
due
are
when it's
in default.
due. You
It's
can't
just,
say, well, hopefully they open the government next week and we get it
yeah,
figured out.
yeah. You can't do that to your tummy when you're hungry.
Yeah,
And so I just think that I'm just happy that you were able to come on to the Terry Talk to just really explain your own story. There's nothing more powerful, I think, than to hear directly from Alabamians. And when you're from my district as well, that's an even more powerful reason. But when you see Alabama families struggling, and when you see people like yourself who are hardworking, like you said, you have a job, you get up every morning, you go in do your job, you actually pay for your own health insurance, and
yeah,
you were able to do that because of the Affordable Care Act and those tax subsidies. So, Virginia, in closing, I just want to say thank you. I want to thank you on behalf of the folks that are also living in my district, but also the folks in the state of Alabama for your willingness to talk about how this directly impacts you. I want you to know that I will roll up my sleeves and talk across the aisle and work across the aisle with any of my colleagues to keep government open and to make sure that we're taking care, protecting, saving the health care of millions of Americans. I don't
yes,
think that it's an either or. It's a and. We can
yes,
open up government and we can protect and save health care. That's what
yes,
I'm talking about. And I just want to thank you for the opportunity to hear directly from a constituent. And I will be checking in on you to make sure to see how you're doing. This is not easy for any of us, but I think that no truer words were said than by you. You want politicians to put people over politics.
right,
You want the people to be the front and center and not someone's political party. And
right.
I pledged that when I first got into office, and I've tried to live that. And I can tell you that I was in Washington ready to work, and we even went on the House floor. And we were gavelled out because Republicans are not going to have the House meet again until next
Wow,
Tuesday. It's just
wow,
really scary. But at
yeah,
any rate, thank you, Virginia, for telling your story. And I do know that there are so many of us who are rooting for you and rooting for the American people because we all win. We all win when people have access to affordable health care and help. And thank you for just putting a face to that story and making sure that folks understand what's really at stake. So thank you so much. And to my constituents, stay tuned to another Terry Talk in the future. Do know that your Congresswoman is ready to roll up her sleeves and go back to Washington to open up government and to protect your health care. Thanks.